Vertigo. Vertigo is a symptom of vestibular dysfunction, related to inner ear or sense of balance. Vertigo has been described as a sensation of motion, most commonly rotational motion. It is important to differentiate vertiginous symptoms from other forms of dizziness, such as lightheadedness or feeling faint. Vertigo is a sensation that the environment around you is spinning in circles. It can make you feel dizzy and off balance. Vertigo isn't a disease. Rather, it's a symptom of varying conditions. Vertigo affects all ages. In younger patients, middle ear pathology is most often the cause. In the elderly, specific assessment is needed due to the risk of falls and their complications. Are there different types of vertigo? There are two main types of vertigo. Peripheral vertigo, this happens when there's a problem with the inner ear. Central vertigo, this occurs when there's an issue with the brain. Causes can include infection, brain tumors, traumatic brain injury or stroke. What should I know about vertigo versus dizziness? While both dizziness and vertigo are considered balance problems, the two symptoms are different. Dizziness is an overall feeling of being unbalanced. With vertigo, you have a sensation that you're moving or that your surroundings are spinning. What does vertigo feel like? Many people compare vertigo to motion sickness. It can make you feel like you're spinning, rocking or tilting. Feelings of unbalance may worsen when you stand, walk, change positions or move your head. Is vertigo a serious condition? Vertigo can be scary, but the condition itself isn't considered serious. However, vertigo can be linked to other potentially serious health conditions. Is vertigo hereditary? While vertigo isn't hereditary, it can be a symptom of a range of conditions, some of which run in families. Therefore, frequent vertigo attacks could involve genetic factors. Can stress cause vertigo? Stress itself doesn't cause vertigo, but it can contribute to inner ear dysfunction. This can lead to vertigo attacks in some people. Approximately 5% of American adults experience vertigo when they're anxious or stressed. What are common vertigo symptoms? As mentioned above, vertigo is a symptom of many different conditions. Symptoms. However, vertigo can also occur in combination with other symptoms, including nausea and vomiting, balance problems, tinnitus, headaches. Motion sickness, a feeling of fullness in the ear, nystagmus, in which the eyes move side to side uncontrollably. Prevention of vertigo. How do I stop vertigo attacks? There are a few steps you can take to reduce your risk for vertigo. These include taking extra time to stand up, turn your head or perform other triggering movements. Sleeping with your head elevated on two pillows. Sitting down as soon as you feel dizzy. Squatting instead of bending over when picking something up. Causes of vertigo. Vertigo is a symptom of several different conditions. There are two types of vertigo, known as peripheral and central, depending on the cause. Peripheral vertigo. Peripheral vertigo is the most common type, often caused by a problem with the balance mechanisms of the inner ear. The most common causes include 1. Benign paroxysmal positional vertigo, BPPV. 2. Head injury. 3. Labyrinthitis. 4. Vestibular neuronitis. 5. Meniere's disease. 6. Taking certain types of medication. These causes are explained in more detail below. 1. Benign paroxysmal positional vertigo, BPPV. This is one of the most common causes of vertigo. It can occur during specific head movements, while standing up or bending over, crossing the road, or turning in bed. BPPV involves short, intense, recurrent attacks of vertigo, usually lasting a few seconds to a few minutes. It is often accompanied by nausea, although vomiting is rare. You may also experience your eyes briefly moving uncontrollably, nystagmus. Lightheadedness and a loss of balance can last for several minutes or hours after the attack. BPPV is thought to be caused by small fragments of debris, calcium carbonate crystals, which break off from the lining of the channels in your inner ear. The fragments don't usually cause a problem, unless they get into one of the ear's fluid-filled canals. Calcium carbonate crystals. When your head is still, the fragments sit at the bottom of the canal. However, certain head movements cause them to be swept along the fluid-filled canal, which sends confusing messages to your brain, causing vertigo. BPPV usually affects older people, with most cases occurring in people older than 50 years of age. BPPV may occur for no apparent reason, or it may develop after an ear infection, ear surgery, a head injury, prolonged bed rest, for example, while recovering from an illness. 2. Head injury. Vertigo can sometimes develop after a head injury. If you have symptoms of dizziness or vertigo following a head injury, seek medical attention. 3. Labyrinthitis. Labyrinthitis is an inner ear infection that causes a structure deep inside your ear, the labyrinth, to become inflamed. The labyrinth is a maze of fluid-filled channels that control hearing and balance. When the labyrinth becomes inflamed, the information it sends to your brain is different from the information sent from your unaffected ear and your eyes. These conflicting signals cause vertigo and dizziness. Labyrinthitis is usually caused by a viral infection, such as the common cold or flu, which spreads to the labyrinth. Less commonly, it's caused by a bacterial infection. Vertigo caused by labyrinthitis may be accompanied by nausea, vomiting, hearing loss, tinnitus and sometimes a high temperature and ear pain. 4. Vestibular neuronitis. Vestibular neuronitis, also known as vestibular neuritis, is an inner ear condition. It causes inflammation of the nerve connecting the labyrinth to the brain. In some cases, the labyrinth itself can also be inflamed. The condition is usually caused by a viral infection. It usually comes on suddenly and can cause other symptoms, such as unsteadiness, nausea and vomiting. You won't normally have any hearing problems. It usually lasts a few hours or days, but it may take 3 to 6 weeks to settle completely. 5. Meniere's disease. Severe vertigo is sometimes caused by a rare condition that affects the inner ear, called Meniere's disease. This can cause vertigo, as well as hearing loss, tinnitus and oral fullness, a feeling of pressure in your ear. If you have Meniere's disease, you may experience sudden attacks of vertigo that last for hours or days. The attacks often cause nausea and vomiting. The cause is unknown, but symptoms can be controlled by diet and medication. Surgery. Rarely, you may need further treatment in the form of surgery. Central vertigo. Central vertigo is caused by problems in part of your brain, such as the cerebellum, located at the bottom of the brain, or the brainstem, the lower part of the brain that's connected to the spinal cord. Causes of central vertigo include 1. Migraines, a severe headache that's usually felt as a throbbing pain at the front or on one side of your head, which is especially common in younger people. 2. Multiple sclerosis, a condition that affects the central nervous system, the brain and spinal cord. 3. Acoustic neuroma, a rare, non-cancerous, benign, brain tumor that grows on the acoustic nerve, which is the nerve that helps to control hearing and balance. 4. A brain tumor in the cerebellum, located at the bottom of the brain. 5. A transient ischemic attack, TIA, or a stroke, where part of the blood supply to the brain is cut off. 6. Taking certain types of medication. Other causes can lead to vertigo. These include medication-induced vertigo and 7. Psychologic disorders, including mood, anxiety, and 8. Somatization. Medications that have been associated with vertigo include anticonvulsants such as phenytoin and salicylates. Pathophysiology. Asymmetry in the vestibular system accounts for the symptom of vertigo. Asymmetry may result from damage or dysfunction in the peripheral system, such as the vestibular labyrinth or vestibular nerve. Asymmetry in the vestibular system accounts for the symptom of vertigo, or a central disturbance in the brainstem or cerebellum. Though there may be a permanent vestibular disturbance, the symptom of vertigo is never permanent as the central nervous system adapts over days to weeks. Tumors can cause vertigo. Complications. The key to arriving at the diagnosis is to differentiate vertigo from other causes of dizziness or imbalance. Central from peripheral causes of vertigo needs to be distinguished. An accurate diagnosis is essential in life-threatening causes. These include neoplasms, infection, and cerebrovascular accidents.